So welcome everyone. We will wait a few minutes, 2 minutes for people to join the call, and then we'll start. But we give just a few minutes for people to join. So I think we'll start. Welcome everyone. My name is Zainab Naimi. I work at the Department of Maternal, Newborn, Child, and Adolescent Health at WHO headquarters in Geneva. Before we go ahead with the webinar, I would just like to remind you that we have some house rules. These are available at the top of the chat window, but I will just repeat them so everyone's reminded. Everyone is muted on entry, so we only unmute the speakers. We will have a question and answer session after the presentation. So please do post your questions in the chat room during the presentation and send them to all participants. And if that's not possible, send them to all panelists. So don't send them just to the host. My colleague, Benedict Walter, she will note down all the questions and read them out loud in the question and answer part of the webinar that she will be moderating. And as usual, if there's any questions we don't have time to answer today, we will share them with our speakers and then answer them on the website on the following days. Just to remind ourselves, the Network for Improving Quality of Care for Maternal, Newborn, and Child Health has been organizing series of webinars on selected topics for quality of care with a specific focus on country implementation and QI implementation science. Today's webinar is the second of a deep dive we're having into WASH improvements and how these can contribute to better quality of care. The last webinar took place a few weeks ago, and we looked at the Ethiopian Clean and Safe Health Facility Initiative, also called CASH in short. We had the pleasure of hearing from Mola Gotis from the Ministry of Health and Tedros Fantahun from St. Paul's Hospital Millennium Medical College. And they shared how they had been implementing the National CASH Initiative. And as usual, the webinar was recorded and it can be found online on the network website. We are now delighted to welcome you to today's webinar on the WASH-FIT tool implementation in Cambodia. Our speakers today are Dr. Hoy Vanera from the Cambodian Ministry of Health and Ms. Safari Fan from the World Health Organization in Cambodia. They will speak to us about how the WHO UNICEF Water and Sanitation in Health Facilities Improvement Tool, called WASH-FIT, has been used to drive quality of care improvements at the healthcare facility level in the Cambodian context. The Ministry of Health has tested the tool in 21 healthcare facilities to facilitate improvements in the areas of water, sanitation, hygiene, and healthcare waste management. The initial results have shown substantial improvements, and they are now exploring how this approach can be scaled up. First, so Ms. Safari Fan will explain how maternal and newborn health relates to WASH at the national level in Cambodia. She will give us an overview of the WASH fit improvement framework, and set of tools that can be used to drive WASH improvements. Ms. Fan holds degrees in chemistry and environmental technology and management. She has worked in the field of WASH for numerous years with extensive field experience and over 8 years with the WASH program in UNICEF. She now works as a WASH technical officer in WHO Cambodia. Dr. Hoy Vanera will then describe specific cases of WASH fit in healthcare facilities. He will describe how the WASH fit tool can be adapted to specific facility contexts and streamlined to support existing national quality improvement standards. Dr. Vanera is a medical doctor. He holds a master's in public health and has been working with the Ministry of Health for over 20 years, 16 of these which were at the Provincial Health Department and 4 which were at the National Ministry of Health, Quality Improvement, Quality Assurance. So without further delay, I give the floor to our speakers, Dr. Vanera and Ms. Fan. Please go ahead. The floor is yours.
Jesse, you need to unmute your computer.
Hello. Hello, I'm Vanra speaking.
Great.
Hello.
Please go ahead.
I will present about background of the WASH fit in the Cambodia and so Pari will present the implementation of the WaSH fit in the Cambodia in 2017. So for me, I just talking something that relating on the background of the WaSH fit implementation in the Cambodia. So the first all, I thank you on behalf of the team. I thank you of my team, Dr. Doksurun from is my boss, Dr. QoC, Dr. Okrumnia, that is in my team from the MOA. And we also thank you the WaterAid, thank you from the UNICEF, thank you from the rainwater of the Cambodia, and the end, thank you for the WHO that bring that we all bring together to work for the WaSH fit in the Cambodia. So, according to the Cambodia Demographic Health Survey from 2000 until 2014, so we see that the pregnant women go to the health center or go to the public facility for the deliver is increased from 10% in 2000 until 80% in 2015. It means that a lot of the women, the pregnant women, go to the public healthcare facility to
Dr. Vanera, we can't hear you anymore. Dr. Vanera? Hello, Jessie, Dr. Vanera, oh, Chantea, can you hear us? We have no sound from you anymore. Everybody on the line, please hold on for a second. Hello?
Hi, Benedict. Now the computer with Jessie could not hear.
Okay, can they move on to yours maybe?
Okay, maybe Dr. Randa come to mine and then talk from mine.
Okay.
Okay, please. Yeah, thank you. Yeah, he will be talk from my account. Okay.
Okay. Can you hear me? Okay.
We can hear you now. You will need to find a way to move the slide from the other computer. Is that feasible for you?
Can you hear him?
We can hear you. Can you move the slides as you speak from the other computer?
I could not move the slide because I'm not the one with that. Because I don't have a board. I just gave you the presentation if you want to open it up.
So you need to open the slide from your computer, Chantea. Everybody on the call, please hold on. Thank you for your patience.
Yeah. Okay, please send to my, okay, from here. You can, we open, but how can, from Jessie, you press the PowerPoint.
Chantea, can you mute yourself, please?
Go to your...
Yeah, yeah.
Okay. Jesse, if you open up the PowerPoint...
Where can I open up the PowerPoint?
I sent you an email if you can open up the PowerPoint in your computer.
Yeah, I open the one more to carry to the same.
So
here.
open up that one.
But then how can the participant can see our...
Go back to your WebEx.
WebEx?
Go back to here.
Yeah. How can I upload that? Because I don't have the bowl. So actually, I can open the PowerPoint from my computer, but only us can see that, but the audience could not see.
We need to mute ourselves.
Share. Click on share on top of the screen. Do you see share?
I just gave you the presenter ball, so hopefully it should work.
Thank you, yes. Can you see the share button, Chantea? Perfect, thank you. We can see the presentation now if you make it full screen.
Okay.
Thank you.
Okay. Hello, you can hear us?
Yes, we can hear it and we can see the
I
presentation.
hand over to Dr. Vanera to continue.
Yeah. So you can hear me, so I will speak again. I'm sorry because my English is limited. Hello?
No problem, please go ahead.
Okay, yeah. So the first slide, I show you about the partner that working all together to bring the WaterAid in the Cambodia. So the next slide, I show you about the improvement of the newborn health and the maternal health in the Cambodia. So a lot of the pregnant women go to the health center or the hospital for the delivery. So if we look at the line, the red line, we can show the slow decrease of the children under 28 days that die. But we have the better for the children under 5, the decrease from 124% per 1,000 live birth until certified. But for the neonatally, is a slow and small the decrease. And the problem is maybe linked to the infection control, linked to the poor the infection control of poor work that implement in the Cambodia. This is one of the reasons, but a lot of the reasons that contribute to the die of the children that under 28 days. So, according to the survey in 2017, the MIH worked with the WHO, the UNICEF, the WaterAid, conduct the survey in 2017. So, we take the sample size 100 about over 100 healthcare facility. So we survey about the water. So we found that for the water is about 91% of the healthcare facility that we survey has the water. But about the hygiene, about the healthcare or sanitation, so we still poor. All the healthcare facility that we go to see or we conduct the survey, we found that the healthcare where the hand hygiene, sanitation is still poor. So related to the health, the strategy plan from 2016 until 2020. That related to the water. So for the ratio of the maternal mortality rate per 1,000 live birth, the baseline in 2016 is 170. So the target in 2020 we want to reduce until 130. For the neonatally mortality rate per 1,000 live birth, the baseline in 2016 is 18. For the target, we want to reduce until 14. For the public health facility with the water, the baseline in 2050 is 91% that has the water. So we want to increase until 95% of the facility. So for the hand hygiene or sanitation, the baseline in 2015 is about 99%. So the target 2020 we want to increase until 90. So for the water. What is one part of the quality improvement of the H-EQIP? Because now in Cambodia, from 2016 until 2020, the Cambodia has a big the project would like to improve the quality of the healthcare. So all the healthcare facilities in the Cambodia must under this project. So every 3 months, all the healthcare facility, especially the health center and the hospital, will have the assessor from the MOA, from the other the province go to assess the health center and the health center. So the tool for the assess the health center and the hospital has 3 components. The component 1 is assess about the structure, and the component 2 assess about the process. The component 3 is assess about the outcome. So the work is WaS is stay in the component 1 is the structure. So after the access, every healthcare facility will got the bonus from the MOA. So that is all from my presentation about the background and something that related to the WaS implementation. And so Pari will present the detail about the implementation of WaS in the Cambodia. So thank you.
Thank you, Dr. Vanara. Thanks for your time and coming to share the background. So hope you can hear me clearly. This is the good background from Cambodia that is now we can see the increasing of women go to health center or healthcare facilities for delivery the baby. Then the situation of the water sanitation is still far behind, that we need to work a lot more. Especially you can see water is already 90%, but when consider year round, it will drop down significantly. It will be by half, it dropped down by half. While look at sanitation, hygiene, and healthcare waste management is very behind. Then Ministry of Health is strongly committed. Now they set the target for water and sanitation in the health strategic plan from 2016 to 2020, which a lot more need to be done, especially around sanitation. The baseline is only 39%, and they commit to reach 90% by 2020. So WHO introduced the WaS Fit tool, which is a good timing to introduce this tool as the guiding principal tool leading for improvement in healthcare facilities. So this tool is leading to the improvement beyond water, so it will drive for improvement on sanitation, healthcare waste management, hygiene, cleaning and disinfection, also the whole environment around the healthcare facility. And again, the most important part also is the management part. Yeah, this tool is risk-based continuous improvement framework and associated tool, and it's launched by globally in March 2017, and we bring this tool to Cambodia early in year 2017. The team from Cambodia consists of government and also key partner. Got a TOT training in January 2017. Then the team come back to the country and they translate the tool into country context, lead to TOT training in the country, and also start testing the tool in 21 healthcare facilities. So one of them is the mid-level referral hospital. So 20 is the smaller setting and one mid-level of hospital. And this is led by Ministry of Health with support from us all, WaterAid, WHO, and UNICEF together. And this tool consists of 5 steps. So one is the establishment of the team in the health center or hospital. Then the team needs to conduct assessment. There is an assessment checklist that the team can walk through and check where they are and what needs to be improved. Then after that assessment, the step 3 is to identify and prioritize area for improvement based on the risk level that we found in the step 2. Then the important part is the step 4 is about developing a work plan and implementing that work plan. Number 5 is also very important for the continuous monitoring and continue making improvement in the facility. this is just briefly on each step that we walk through with some lesson learned that we want to share with you. So step 1 is more on establish the team and train the team to work on WaterAid. Then in this step, we learn some lesson around that, especially here we have different settings, like health center considered as the smaller setting, and then at the middle level is the district referral hospital. So for district referral hospital, it is good to consider having a team or not. It depends on whether there is an existing team, for example, like IPC team established at the hospital. If there is already, we don't need to establish the new team. While the small setting like health center, it doesn't need to have a team established. It's easy to just work with the director to be a lead for that, and all staff can participate in this improvement. Then yes, also there is a need to also identify role and responsibility. I need to speak quickly because I already get a note for the time up. So I walk you through the step 2, which is the assessment at the facility. So there is a guidance with the WaterAid to do the assessment, and from that we learn that the assessment indicator need to adapt to the standard at the country context. For example, like IPC, infection prevention and control, and healthcare waste management, also at the water sanitation that is already exist in the country. Again, it needs to align indicator with the H-EQIP, as Dr. Vanara already mentioned. Government not just set the target in the health strategic plan, but they also have a number of indicators in the health equity and quality improvement program to really improve that water sanitation in healthcare facilities. Also, the assessment indicator probably need to reduce because some of the advanced indicator which may not fit well with the small setting like health center. So I think sanitary inspection form is also introduced in the WaterAid tool, which to some extent it doesn't need to use, but in some place it may need to use it. It depends on one to another with the specific location. So step 3, it is more about identifying and prioritizing area for improvement based on the risk we identify from the step 2 after the assessment. So we also learned that healthcare setting, especially health center or hospitals here, immediately they start doing improvement, which is more on what they can do immediately. It is not based on the level of risk. So it's more on costing and what they can do quickly. Then also this step is often overlooked by the team because they may have limited capacity on linking to the health risk and in terms of prioritization. Also, it's a little bit of burdensome, so streamline this step, probably just put together with step 2 is much easier. Step 4 is the development and implementation of the work plan. So the work plan should consist of the information, based on the information from step 3, and then decide action plan that should be taken. And then who will be responsible for each improvement activity. And also keep record of the improvement activity with the improvement date and also with the resource. Yeah, here we also learned that a good improvement plan can inform facility operation, can also identify budget and training needs here. Also, it will associate with cost estimate that can help facility to mobilize funds at their area. Also, it will help addressing infrastructure, water supply, and also behavior practice with that good planning. Then step 5 is linked to the monitoring and continuing improvements here. We do some, we seem to have a little bit experience on here, and we should do more with this one, especially having a good baseline that we can compare and then see where it is and what needs to be improved later on. Also, it's also good to involve all staff when it comes to the review and also decide what should be the next improvement needed. Positive impact, we did a quick assessment to 9 healthcare facilities out of the 21, and we see some improvement which I will not read through this, but probably you can see from the visibility. Okay, sorry. Yeah, so one of the catching message from the healthcare director that we learned from this quick review is that one of the healthcare director mentioned that before the WaterAid training, he didn't know the status of healthcare facility in regard to water sanitation and infection prevention and control. But after that, he know a lot. He understands better than before. Another director also highlight the importance of having this WaterAid training and doing the improvement that he learned that the patient have more confidence in the quality of service in his healthcare facility. The hospital director also notified to us that the WaterAid can help him a lot in terms of evaluating, identifying problems in the healthcare facility, and also give him a good direction for where and what he needs to do improvement. This is a quick share to you how the hospital level, the healthcare facility make some improvement. Then, for example, like Latin here, the improvement made by connecting to the hand washing facility. They put a sign for men and women. Also, in terms of the internal building, they have a lot of improvement which we didn't have the pictures here, but they also provide additional hand washing station that can be accessible by patient also, with also the instruction for how to wash hand and also with the power for cleaning and so on. Also with the healthcare waste management, before they just use the bin that is not meet the standard, and also they just collect all over the place within the compound and burn it everywhere. But after the WaterAid, then they have a standard bin for collecting different waste generated from different point of care. They also have a point for final disposal, which is better compared to the one before WaterAid introduction. Yeah, this is another improvement made. Okay, overall lesson learned from that. There are some challenge and also some encouraging factor around that. So one is the knowledge on WaterAid process that the facility have. Even we conduct one training, it will not enough. So it needs more training and make sure that everyone benefit from that training. Also, poor practice in healthcare waste management. So most of the healthcare facility have very poor practice around that. So this is the big area that need to work more. And this is consistent with the survey data that we already saw from the first 2 slides. Then also in terms of administrative responsibility, staff at the healthcare facility level have a lot of responsibility, a lot of forms to be filled in, a lot of things need to be practiced and monitored. And again, because Cambodia has no wash standard, up to now we try to help with the draft standard for wash in healthcare facility, but before no, so they get a lot of mixed message around that. And the encouraging factor is that the facility are very exciting and action-oriented. Immediately we ask them to do, and then they try to mobilize funds to do quickly. Also, the facility benefit from sustained guidance and support. That is what we are trying to help them. And again, the health equity and quality improvement program will give all the funding, that they can use for improvement. Also, there is an incentive grant for all staff to contribute and participate in the improvement activities. Yeah, that's it.
Thank you very much, Safari. That it was very detailed steps and lessons learned. Clearly, the lessons of what has happened and what worked and what didn't work has already been done, which is interesting for this network. You got 2 questions at this point typed while you were talking, while both Dr. Vanera and you were talking. The first one is from Catherine Dunlop, and she asked if the WashFit tools are available for others to use or to adapt to different settings.
Sorry, once again, can you repeat the question?
Catherine Dunlop is asking if the WashFit tools are available for other people to use, and if they are adaptable for different settings.
Okay. Yes, it's within Ministry of Health already, but because I mentioned already, we start by contextualize and testing it. So we need to review and modify, simplify, and then we commit to finalize it and make it available for everyone, including the standard wash in healthcare facility guidelines, so that it will committed by this year to make it available for everyone in the country.
Okay, thank you. We have another question from Arabella Hayter on what are the biggest improvements you've seen in healthcare facilities as a result of WashFit? What was the effect on staff, the patients, or the community?
It's a number of things, especially within the compound of healthcare facility. We haven't managed to expand to reach our community yet. But within the healthcare facility, as I already told you, that there are some of infrastructure improvement in terms of latrine itself, which different signboard is designated for women and men, with additional hand washing facility, with soap, with instruction how to wash hands. Then also with the in terms of cleaners for the cleaning and infection, they know how to use chlorine solution for disinfection and cleaning, and especially the healthcare waste management, which we consider the poorest part in this country. The practice is very poor in terms of segregation, storage, and the final disposal. So among all the healthcare facilities that we pilot, they tend to improve a lot in this area, and especially the mid-level referral hospital, it turned out to be more demand for service, more clients come to this hospital.
Thank you, Safari. You have more questions coming in. One is from Zainab Naimi, about what kind of adaptation small facility made after implementing the tool. Can you give an example?
For example, like part of the healthcare waste management, they build additional like pit for collecting the burning ash from incinerator. They put a proper pit, and then they put in that proper pit as the final collection of the remaining burning ash, and also especially the behavior of the medical staff themselves. for practicing hand washing and also behavior toward the patient.
Thank you. A question from Marcel Siever-Freundel, asking you if you could give an idea of how long the process takes in each healthcare facility, and what are the plans from the Ministry of Health to scale WaterAid up to more healthcare facilities?
I should give this question to Ministry of Health. Yeah.
This is a question. This is a question for Dr. Vaneva.
Yeah, actually, our testing starting from July, and the lesson that we share to you is collected by December. So this is 6 months, and if consider facility to facility, if we have enough resource to train and help them leading that, it will be quicker. But because Ministry of Health also doesn't have enough resource to do training quickly and monitoring. So this is 6 months from the starting of the tool, introduction of the tool and the implementation. And it is true there's a lot more time need to be done, and especially the improvement, it cannot be one time off. It needs to have a continuous improvement, especially the practice of hand washing, healthcare waste management, fabrication, and so on. Then I may need to hand over the question on what is the commitment of Ministry of Health to take over on the WaterAid. Do you have any specific response to that? For me, as we present already, now the government commit to have WaterAid target in their health strategic plan. They also include a lot of monitoring indicators related to water sanitation, healthcare waste management in the quality monitoring tool, which they monitor regularly, quarterly. And there is an incentive grant to encourage healthcare facility to make improvement also. So you want to add anything, Dr. Vanara?
Yes, as Paris said, for the MH, have the support, the strong support and commitment of the water implementation in the Cambodia. Because the water improve the quality of the health care in the health center, in the hospital. That is why the Cambodia made the H-EQIP the project to support the work, and every 3 months. So the MH and the partner will go to the public health facility to assess the health center and the hospital. So that is all from the MH. So it's in the summary, it means that the MH strongly support the work.
Thank you, Dr. Vaneva.
Yeah, I just hand over to my colleague from WaterAid. She wants to add something on that.
Sure.
Yeah. So let me add some of the ongoing activity in how our WaS in healthcare facility team here continue to work closely with Ministry of Health on this topic. So incoming, like we are, as the Dr. Vandra mentioned, Dr. Pari mentioned that government is roll out the improvement in healthcare facility. So this type of quality improvement, we try to contextualize our WaterAid, and we try to redesign it in order to fit with the existing monitoring system, where we believe that this part, it can be more easier to scale up, and it is part of the system that already currently rolled out by Ministry of Health.
So we will contextualize, redesign, and learning from what we are doing. We are testing quite like recently 6 months. And another of the opportunity as the WaterAid itself doesn't have, H-EQIP itself doesn't have the coaching module specific for health center or healthcare facility management. It is where the WaterAid can be one key component that can be included in the coaching module in order to address water in healthcare facility. Thank you.
Thank you. You have 2 more questions at this point. One from Melissa Bingham asking, since this tool is used at the facility level, what are the mechanisms to inform this change at hospital level up to the subnational and then the national level?
What mechanism that we can inform the change? Is that correct? This is the question?
Yes.
Okay. We did one national learning event, and also we organized one provincial learning event, bringing together different stakeholders and partners at national level and also with the learning event at provincial level. This is one of the quick mechanisms that we already implement so far to really sharing all the lessons learned and challenge need to be addressed by different levels of health sector. And we plan to have more to develop a platform for information sharing, especially try to encourage Ministry of Health to take the lead on that. And also there is a technical working group chaired by a very high level officer at Ministry of Health, which we already present one time on the learning, the finding of water sanitation situation in the country. So this is the platform that we will work more, that we can share all this lesson and challenge, because this platform is attended by all the high level decision maker, while at the ground level we will continue to do more with the learning, meeting, sharing information.
Thank you. And one last question from Mitsunori Odagiri, asking what are the strategies to increase sanitation access from 39% to 90% by 2020?
It's a good question. The sanitation in the country led by different ministries, so that is also a very challenging. Within the rural community led by one ministry named Ministry of Rural Development, while the urban one led by Ministry of Public and Transport. And within the healthcare facility itself, Ministry of Health needs to work together with the other 2 ministries in order to really accomplishing this commitment. And in the country, it's already committed to have 100% in all settings, community, school, and health settings. This is the government commitment to reach 100% by 2025. So I think it will push through by government. It's not just the health sector itself to reach 100%, but separately by Ministry of Health. They commit for 90% by 2020, which I'm sure with the guideline that we support, it will guide that achievement, and also with the health equity and quality improvement program, because there is a funding for some improvement, and also there is an incentive, so that will also encourage that target reaching. Then again, I hope from this WaterAid, with each healthcare facility, they will have a proper plan and target to reach the standard. So that is another encouraging environment. So Dr. Vanara, do you have any additional point to add? The question is on what is the strategy to reach sanitation 90% by 2025, based on the baseline now is 39%. Okay.
So, please.
Okay.
So the first, the made the project called the H-EQIP. What is this? Yeah. So this is the project that lasts from now until 2021. This is one of the strategy that the H wanted to improve the sanitation in the Cambodia until 90% in 2020. And one more thing about the strategy plan. So you can see here the percentage of the public health care facility with the basic water supply and the sanitation. This is the commitment that the Ministry of Health set the target and wanted to improve. Yes. This is from the MOA. And from the other of the ministry, I think the Ministry of the Tourism, the Ministry of the Urban and the Rural also join. Yes, thank you.
Thank you, Dr. Vanera. Maybe
yes.
if it, can you hear me?
Yes.
Okay. If it's okay for you, Dr. Vanera, and for you, Safari, I was wondering if Arabella Haite, who is on the call and works closely with you on WashFit and in WHO, could give a little bit, answer a little bit the question about how WashFit can be adapted to other settings and has been used in other countries. There was a question about that. Is that okay?
What do you mean by other settings?
Sorry? In other countries.
In another country.
Just how it has been used. We have a few minutes left, so maybe that will answer the question from that person at the beginning of the question and answer session.
For me, WashFit is a guiding principle tool which different countries need to translate into their context. For example, like Cambodia, there's a lot of different things going on here, which we cannot just bring the whole tool and introduce here, but it needs to really see what is needed based on what is already exist, and then where the WashFit can build in to the country. So for me, it's difficult to tell, and also in terms of water sanitation, probably it's more different from one to another. Like Cambodia, the water sanitation is not led by Ministry of Health, it's led by another sector. While in other countries like Laos, as far as I know, it's under Ministry of Health. So it's probably much easier than Cambodia to introduce WashFit within ministry, the same ministry led health and water sanitation. So training and advocacy probably may need it, and especially the commitment of the lead sector to translate that too. Anything you want to add from the team? Okay, that is the answer. It may not give you the full picture, but that's what I think.
Thank you. Arabella, you want to add to this in the next 2 minutes that we have left? You need to unmute yourself. Or somebody needs to unmute you. Zainab, can you unmute Arabella, please? Zainab, can you unmute Arabella? Okay, Arabella, sorry. Can you type your answer?
I have unmuted her.
Okay, good. Yeah. Thank you. We can't hear you. Okay. That's okay. We can probably follow up. Zainab?
Yes.
Over to you.
Okay. Great. Thank you, Dr. Vanera. Thank you, Ms. Khan. It's been a really interesting presentation and discussions. Thank you especially to Dr. Vanera for giving us a very comprehensive understanding of the national context and how this implementation links to the National Health Strategic Plan and also the National Health Equity and Quality Improvement Project, which I think is important. I think the presentation highlighted many valuable lessons, but there are some I would particularly like to note, and that's the importance of building on existing structures and review mechanisms in facilities. So I thought when I saw that on the slide, a very important message that came across, and also how it's important to involve the facility leadership, but also all facility staff in these quality improvement activities. Another issue that Ms. Fan also highlighted was the importance of aligning indicators, and I think we have a lot of discussions around that on the work around maternal newborn health, and the importance of aligning indicators and reducing the number of indicators being reported, and especially from small facilities. And finally, it was very interesting to see how the implementation experiences can be used very practically to learn and drive continuous quality improvement. So thank you again to our speakers. Thank you, Bene, for the moderation, and to all participants for contributing to this very interesting discussion. I would like to remind you before everyone leaves that the recordings of the webinars are available online on qualityofcarenetwork.org. And as mentioned on the last webinar, we are updating the webinar schedule so you can see what series will be coming up next. And this will be available on the network website and the MPA department website in WHO. And also another reminder is that all previous webinars on the series we had about point of care quality improvement and very specific country examples of quality improvement work from network countries is also available on the website. So if you have missed that, please do go back and listen. And finally, please do share this with your colleagues so we can continue to share these valuable experiences, have a wider audience, and then we continue to learn from each other. So thank you to all, and a good day. Bye.
Thank you. Bye.
Oh my God.